what is heart failure, and then what you have to do if you have a heart failure. After heart attack or coronary artery disease, the next most common thing we see is heart failure, that also called as weak heart. Heart is the main pump in our body, so it has to receive the blood from all the body parts, and then it has to see that it is well oxygenated in the lung, and then it has to supply the purified blood or oxygenated blood to all the parts. If the main heart pump is weak, then you will have two kind of things. One thing, it's unable to pump to the body, so that's why your blood pressure may be low, and then you will have uh, weakness and sometimes fainting. And the second thing, it has to receive impure blood from all the body parts. But because it's weak, it's not able to take. So then there is fluid accumulation in all the body parts, especially if there is fluid accumulation or water accumulation in the lungs, then you will have breathing difficulty. And you may have breathing difficulty on walking or day-to-day activities, and then even you may not be able to lie down flat, and then you may have even swelling of the feet, that is even distension of the abdomen, bloating of abdomen. These are the usual symptoms. uh, if you have a heart failure, you face it. And then what precautions you have to take? So the heart failure is because of so many things, like heart attack, and then excess alcohol intake, and then some infections, and then some valvular leaks, and then even because of some birth defects also if they are not treated during childhood. So there are some treatable causes. If there is any treatable causes, like if you're alcoholic, that is if you take regular alcohol intake, sometimes if you stop alcohol consumption, sometimes it may improve. If there is, it's because of heart attack, and if timely, if any procedure is done like bypass or stent, sometimes it may improve. And if there is no treatable cause, then you have to take medications regularly, and then you have to adapt your lifestyle accordingly. First and foremost important thing is take medications, don't skip it. And then second thing is your lifestyle changes, like you have to restrict your salt. Salt is nothing but a sodium chloride. Any excess sodium, it draws fluid, and then there will be fluid deposited in your body. So there is no added salt on the table, and then you have to use as less salt as possible in your food. And then you have to restrict your fluid intake. Depending upon your heart pumping, the doctor will advise what amount of fluid to be taken daily. Usually we restrict to 1.5 to 2 liters per day. And then you have to maintain body weight. Any sudden rise in your body weight or weight gain or weight loss is not good. So if there is sudden weight gain, that indicates that some amount of water or fluid is being accumulated in your body. Suppose if there is more than 2 kgs body weight within 5 days, that is an alarming thing. I think they have to adjust the medication so that they will give some medicines uh, called diuretics to remove uh, body fluid, excess body fluid in the form of urine. So for that, you have to monitor daily weight immediately after passing urine in the morning and before having a breakfast. Regularly, you have to check your weight, and if there is any deviation, then you have to inform your doctor. And then you have to do physical exercise. The exercise strengthens your heart, but in a heart failure patient, then what is the amount of exercise you are allowed, that will be decided by doctor. And then don't stretch yourself much, and then you have to listen to your body. Whenever you are feeling breathless on exercise, then you have to stop, but you have to continue your physical exercise within your limits. And then you have to stop taking any alcohol, because alcohol weakens your heart muscle. It's not like a heart attack The heart attack sometimes will allow some amount of alcohol consumption if your heart pumping is okay. But in your heart failure, it's absolutely no. And then you should not uh, use tobacco consumption, and then you have to be in regular follow with your doctor. So if you follow these things, your quality of life will be good, and even your life expectancy will be improved. Thank you.